Welcome to the Lighting Your Way podcast. This season, our sixth, we're talking to my colleagues at Guardian Nurses about how they help our patients navigate a very complex and confusing healthcare maze. At the end of each episode, you'll hear their suggestion as to how you can become an advocate for yourself and your loved ones. Transitioning a loved one home from a rehabilitation facility after a stroke can be a stressful time for families. There are a lot of moving parts involved. Not only is it emotionally stressful, but if not handled effectively, the transition home can lead to an exacerbation of health issues and increase the likelihood for rehospitalization. In this episode, I speak with my Guardian Nurses colleague, Jennifer Donahue, who tells a particularly compelling story about a case that she worked with during COVID. Jennifer Donahue, welcome to the podcast. Welcome back. It's good to have you here. Nice to be on with you.
Thanks for having me back.
Yeah, it's great. This season, we are, as you know, highlighting the amazing work that our nurses are doing at Guardian Nurses, and you are one of those amazing nurses. So I wanted to get you on to tell us your compelling story and share it with our listeners so that we can help them become better advocates for them and their loved ones. So why don't you tee up your story for us?
Sure. So this case took place during COVID. It's something that's stuck with me all this time because, as you remember, it was a particularly challenging time for all of us, both as professionals and as patients.
Yeah.
And this was a very challenging case for me. It all started when I received a frantic phone call from the wife of a patient who was in rehab after having a stroke. This gentleman, unfortunately, had a history of hypertension and high cholesterol, but did not follow up with a primary care physician or specialist and hadn't taken any medications for these conditions in about a period of 5 years.
Oh, so wow. Well, that'll present some problems for you.
Yeah, unfortunately, he ended up having a stroke, which resulted in left-sided hemiplegia. So he had no movement of that left side. He had a trach in place. He had oxygen and a feeding tube as well. So the wife was calling because the patient was in process of being discharged home the following morning, and she was just scared that she was not going to be able to properly care for him.
Jen, discharged from the hospital or discharged from the rehab?
From the rehab.
Okay. So how long was he? It sounds like it was a pretty significant stroke. How long was he in hospital?
He was in hospital for about 3 weeks.
Wow.
And then went to rehab for about another 3 weeks.
Wow. Okay. So this was pretty significant.
Yes. Yeah. He had, he required a lot of care.
And was it just she at home? Just her at home?
Her, and they had 2 daughters as well, one that was living in the home but was not very reliable, and another one that didn't live too far away but had small children. So again, the reliability was it wasn't going to be there. It was mainly care was going to fall on the wife.
Okay. And 6 weeks in facilities, I'm going to bet you're going to tell us that it was a pretty lengthy discharge orders. Yeah.
It was. He had extensive pages. We kidded around at her home visit saying that it was as long as a CVS receipt. They were
right. And if you've been to CVS lately, it's a lot of paper, and there's only you buy one thing and you get all these coupons and stuff. So, okay.
You could wallpaper a room with the amount of paperwork this poor woman had to go through. So I offered to meet her then at home the day that he was arriving home so that we could go through everything together and make heads or tails of it. Because they were, like I said, they were completely overwhelmed and not sure where to start.
What status? What clinically was he when he was coming home after 6 weeks? Where was he at clinically?
He was a complete care. He
Oh,
was still very weak on that left side. He still had the trach in place
oh,
and required oxygen. He still had a peg tube in place, so he had tube feeds. He needed nebulizer treatments
oh.
and and trach care, obviously, and then medications, which they weren't used to dealing with. He wasn't taking medications on a regular, so this was all very, very new to them.
Wow. Why did they, I mean, I think I know the answer, but why would they discharge him in such a dependent state? Wasn't he getting therapy, rehab, physical therapy, occupational therapy?
He was getting therapies there, and he wasn't making any further gains.
Mm,
So they felt that he would still benefit from continued therapy at home, and the wife desperately wanted him home, although
mhm,
he wanted to get home too. This was during COVID, so all that
mm,
time in the hospital and all
right.
that time they only saw each other a couple of times. It was very hard on all of them, and she felt that getting him home would help him to
Good point.
recover.
Okay. Right. I forgot
And
about
they did get
I forgot that they were COVID. Sorry.
Yeah. And they did get some family education while he was still there in rehab on how to use the equipment and things, but it was minimal because of COVID. And by the time I got there to the house, they were so overwhelmed that everything was forgotten.
Mm. Yeah,
Rehab had sent home
it's a lot to handle.
it, Rehab had sent home boxes and boxes of supplies and equipment for them. So they had everything they needed. He had the hospital bed and wheelchair and a Hoyer lift, but they didn't know how to use any of that.
Mm,
All the supplies too for his feedings and trach care, but again, with no real understanding of what they needed to do and how often they needed to do it.
wow.
So
Was home care ordered as part of the discharge instructions?
yeah, home care was ordered. He was going to get physical therapy, speech therapy, occupational therapy, home health aid. However, he was being discharged over a weekend. It was going to be on a weekend, so
Oh,
professionals weren't going to come out for a couple of days. So this was going to leave the family, to survive on their own for a couple of days. And I was so concerned that this was just going to result in him going right back in
right.
to the facility. I was hoping that making a home visit then and helping them there at home would keep him out of the hospital and safe until the other services would start.
Right. Sounds like it was a perfect storm. There, how many times have we heard patients being discharged on Friday? And it strikes
Yeah,
fear in our hearts.
yeah, it really does. You just in the hospital, these families all say, yep, I've got it. I understand everything, because they're anxious to get their family member home, and they feel, okay, well, I've got all the information there and I'll be able to review it once I'm home. But oftentimes they forget, and then
Hmm.
they're just overwhelmed and nervous, and it can just go badly very quickly. So I thought, let me get there as soon as he's home, and we'll go over things together and see if I can get them set up on the right foot.
How old was was the wife? I mean, were they 60s? I mean, I think that's a lot to handle physically, right? With someone so dependent.
Right. They were, he was right around the age of 60. I think he was 58 at the
Okay.
time.
Wow, that's
And
young.
he was well, but having her own health issues too, she, and being alone basically in the home because the other kids had families of their own, it was a lot for her to take. And she really wanted to do the best for him, but it was very difficult for her to just organize and give him the care that he needed without some more support than she was able to get prior to his discharge.
Wow. How long were you in the home that first visit? I can't imagine.
I spent hours there that day.
Yeah.
We did thing and demonstrating on how to use the equipment and care, organizing medications and supplies. I helped schedule their appointments and the therapies for them so that they would start, first thing on that Monday. The discharge instructions, unfortunately, had told them to, call their PCP with any questions and make sure to schedule that follow-up appointment. But
right. As if you could get a hold of anybody.
Right. And unfortunately for this gentleman too, he hadn't been to that office in over 5 years. So when I called to hopefully schedule an appointment, this physician was no longer in practice. So now had no one to turn to. And that was all the instructions that they received was to call there for help. So they had no one. Fortunately, I had a great team that I turned to immediately for help and advice because it was a lot and this family needed help and they needed it fast. And one of my teammates made me aware of a primary care physician office that makes house calls. And I called right away, explained everything, and they were so wonderful. And we were able to get him established with that provider so that this primary would come to the home and see him right away. And then he would have a physician then to continue receiving regular care with as well.
Wow.
And someone
you hit the lottery on that one. Jeez.
Yeah, that was a really great find, and that was all thanks to my great team coming to our rescue.
Well, we do have a great team. I will admit, and the strength of all of our collective experience and the different ways in which we bring back that experience to the team is, knowing a primary care doctor who will come to make house calls, right? So that's great.
Right.
So did you connect? Did the physician come out to the house during the time that you were engaged with this family?
They did. I saw this patient on a Friday. I made arrangements. The physician and their nurse practitioner had come out on the Monday, and I met them there as well. And we were able to get everything started right away. He had therapy that following Tuesday, physical therapy and occupational therapy evals were done, and he was scheduled then for the other days of the week and speech as well. So he did receive therapies within a week of him being home.
That's pretty good. And especially if it was during COVID. That's really good. Did you have any trouble with any insurance coverage?
He had difficulties with his insurance covering the services that were needed. He had adequate benefit for the therapies that he was receiving at home. So everything was covered under his insurance plan.
So he did not have any issues?
He had no issues.
Oh, that's great. Okay. That's wonderful. So the criteria, I'm just curious for our listeners, the criteria to have a physician or a nurse practitioner, primary care, come to your home to see a patient. What is the criteria for that? Because, who wouldn't want a doctor to come and, have somebody seen in their home? What's the criteria for that?
You would have to be considered homebound, which he didn't have use of that left side at the time. So he was considered homebound. And he didn't have a ramp in his home as of yet. He fortunately was connected with Veterans Affairs, and they had made arrangements to come out and have a ramp installed. But due to weather at the time, a snowstorm was coming, that got delayed.
Oh, that's great. Did you set up the Veterans Affairs connection?
No, I did not. His wife had done that, actually. His daughter had made that suggestion while he was still in rehab before we had met, and she had already contacted the VA about that and made those arrangements.
Wow. I didn't realize. That's great to have those available benefits if somebody's. Yeah. So any veteran did he have to be engaged in the enrolled in the VA system for that?
That's right.
Yeah.
And the benefits for at the VA too, they depend on what war and time served and things like that. They have a bunch of criteria that you need to, in order to be eligible for some of these services. But fortunately, he was, and they were able to come out and install a ramp very
That's
quickly
great.
for him, so that
Yeah,
would help get in and out of the house.
that sounds like it. So, Jen, a couple minutes ago, you said that this was a really challenging case for you. Why was it so challenging? I mean, certainly you've dealt with complex patients with complex issues and insurance issues and home care issues. What made this case so challenging?
COVID, for one, made it very challenging because professionals were stressed out, overworked, lacking supplies, or even access to the patient too. So you weren't allowed to visit them in the facility. It made preparing for a discharge very difficult for the family because there was only limited time that they could go in for education and things like that. So by the time he was coming home, they really didn't have a great understanding of it. They did have all the supplies they needed, but again, not being able to do adequate teaching beforehand, they were going to have to learn at home. And then also getting other professionals out there, home health care services, once he was discharged home, that lag time of going home on a Friday and nobody coming out then until the following Monday, that also made it very, very difficult for the family to have to take care of things on their own without adequate, professional support.
What do you I mean, I heard a lot of the things that you were doing, coordinating the appointments and teaching the wife how to use the equipment. But, in addition to those, what do you think and the support, because I'm sure she was relieved to have you there. What do you think your greatest contribution to the case was?
I think connecting them with a primary care physician right away was going to be of the setup of success. Without receiving regular care that were needed, he was just going to end up in the hospital again, I think. So I think that one was a great starting off point, but then being a support for them to give them that education and providing them, with the instructions on how to manage his care safely and effectively at home. I think that was until, they could get that support from the home care,
And once home care was involved, right, and they were coming regularly, did you still go and visit?
I went a couple of times because I did want to meet with each of the therapists as well so that we could collaborate if they had any questions or concerns, and so that I could, best be a support to them as well. So I did go each time they met with a new therapist. And then we had some regular home meetings after that as well. We talked, though, the member and the wife and I talked almost daily for weeks. And then over the course of months, as he was slowly recovering, we talked a little less and less. And today I'm happy to say he's doing very well, living independently, seeing a physician, his primary and his specialist regularly, and taking his medications.
He better be taking his meds, or his wife will probably, slam him down his throat. Is he still seeing does he still have access to the physician who comes to the home?
So he did for a long while, and fortunately and unfortunately, he was moving, so he needed to get a new physician. And he did get one. Doesn't require having to have someone come to the home anymore. He's able to get around with wheelchair. His brother has moved in with him as well, so he has better support at home, and the equipment that's needed to be able to get in and out of the home and not requiring services inside the home. So
That's great.
it worked out.
How's the wife doing?
Sadly, last year she passed away. She had some health complications of her own and ended up passing away. But prior to that, they were doing very well, managing very well at home.
Oh, I'm sorry to hear that. Wow. So you did a lot and at a critical time, right? That's why the mobile care coordinator program is so valuable, right? That we get to support patients at times when maybe the healthcare system isn't functioning at 100%, and they're not able to get what they need. So your ability to go into the house and to spend the time that was necessary to teach the wife, to reassure her, I'm sure, and for the patient to see you as well and to continue to support, that must have been immensely invaluable to them. So thank you for that.
Of course, it's my pleasure. And I would say really too, I mean, that was a fortunate situation that they had, our support to be able to go in and make this situation, a safer one for them. I would stress though, for, patients and families that don't have that kind of support, no support at home or, overwhelming information from the hospitals, I would say really I would encourage them, don't be afraid to ask questions while you or your loved one are in the hospital or in a rehab facility. Don't be afraid to ask questions. Ask as many as you need to ask until you have all the information that you need and you feel good about it. There's no such thing as a stupid question or asking too many questions. You just need to keep asking until you have a very good understanding of the care that's needed and the treatments that are going to be taking place prior to discharge. And for
Go ahead. I'm sorry.
That's right. And even while you're there too, there are other professionals that can help give you that information, not just from the nurse or from the doctor, but the social worker can be a tremendous asset. So ask to speak to the social worker and talk with them about therapies and equipment and supplies that are going to be needed. Talk with the therapists as well so that you have an understanding of services that are going to be happening after discharge, and even a nurse manager too can help while you're there. So whenever you're in a hospital, there's a lot of staff that can help get the answers to your questions prior to you leaving, when you may not always have somebody else to turn to then at that time. And you want
not everybody has guardian nurses, sadly, but to your strength and credit to explain some of the, I don't want to say tricks, but to talk to our listeners and to say, look, don't be afraid to ask questions. And in hindsight, when I'm listening to you tell the story, I wish that we could go out, not guardian nurses, but I wish that hospital staff could go out and see the patient's home, right? So they could envision what challenges they might have with aftercare, right? With post-hospital care or post-rehab care, but they don't have the time. And but it would certainly be much more effective discharge plan if they did and were able to assess the ability in terms of bathrooms and stairs and even walking up to the house, like you said, with the veterans services to put a ramp in. Yeah.
Right. No, I couldn't agree more. Sometimes the information communicated from the family isn't always completely accurate or understood completely accurately, such as with, the primary care physician. They were understanding that he had a primary care physician when really he had one in so many years, and now this doctor wasn't even practicing. Had that information been known prior to discharge, I don't think that he would have ended up being discharged at the time that he was, but the information doesn't always get communicated correctly, and I think that's another thing that, you just, for patients and families to really talk to the staff and so that everybody's on the same page and really understanding.
Well, and I think that in a discharge from a rehab situation, it's much more effective if the family or the loved one caregiver can request a care team meeting prior to discharge. And if you can take somebody else, doesn't have to be a nurse, but just somebody else to listen and maybe ask the question that you forget to ask because you're an overwhelmed wife, that would be helpful as well. So I think a couple tips for our listeners is not only to ask the questions you want to ask and don't be intimidated by it, but also if you can, and if your loved one's out of rehab, ask for a discharge planning meeting or something where you sit down with those disciplines that are nursing, speech, physical therapy, nutrition, and talk about what's going to happen at home. And maybe they'll just say, oh, well, he'll see his primary. Well, he doesn't have a primary. So then the discussion can become a little bit deeper. Yeah, I wish in a perfect world, right, we could have somebody go out and do assessment of discharge. It would certainly reduce readmissions, to your point.
It certainly would. But that you're right. You're absolutely right. A care conference ahead of time can be extremely effective. I've been in on those many times and seen the success that promotes, for these patients once they're discharged home. That in this scenario, especially too, that would have been a wonderful addition to have and probably would have helped with this discharge. Of course, COVID timing was not in his favor with that. So
right, yeah, that certainly complicated the story. Yeah. I was actually listening to a presentation where they were talking about physician in terms of language and communication, because that's, I think, the number one problem in healthcare. But the physicians typically talk or present information at an 11th grade level, whereas most Americans are at a 5th grade level, maybe even less. And that's when they're speaking English. I know that English wasn't an issue with this patient, but when English isn't your primary language and you're giving paperwork that's maybe in English and it's at a 11th grade level. Anyway, more to come, but that's a different podcast. Sorry, I'm bringing up a lot of issues about discharge planning that you weren't thinking about. Sorry about that. Jen, thank you. Really, it sounds like you did a wonderful job for this family. I'm sorry about his wife. That's sad that he lost his wife after so much support that she gave him and got him through. I'm sure that was a sad time for him. So, but thank you for joining us and for sharing your wisdom as to how patients can become better advocates for themselves and their loved ones. And hopefully this story will help someone in the future. Thank you.
Thank you so much, Betty.
All right. Take care. Talk to you later.
Thanks. Bye-bye.
If you have any questions that you would like us to address in a future episode, please email us at podcast@guardiannurses.com. That email again is podcast@guardiannurses.com. We would love to hear from you. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.